Clinical vignette, rheumatic fever. A 10-year-old girl is brought to the clinic by her mother due to fever, joint pain, and a rash that started 2 weeks ago. The mother reports that the patient had a sore throat 3 weeks ago, which resolved without treatment. On physical examination, vital signs: T38.5, 101.30, HR 110 BPM, BP 160 mm/Hg. Joint exam: painful, swollen knees and elbows, but symptoms improve in one joint while moving to another. Skin exam: erythematous rash with a wavy, serpiginous border on the trunk, erythema marginatum. Cardiac exam: new holosystolic murmur at the apex. Laboratory findings: ESR and CRP, elevated. ASO titers, positive. Throat culture, negative. Echocardiogram, mild mitral regurgitation. Question: what is the most likely diagnosis? A. Juvenile idiopathic arthritis. B. Rheumatic fever. C. Scarlet fever. D. Kawasaki disease. Correct answer B. Rheumatic fever. Explanation: this patient presents with migratory polyarthritis, fever, new onset murmur, and erythema marginatum following an untreated group A streptococcus pharyngitis. These findings are consistent with acute rheumatic fever, ARF. Diagnosis is based on the Jones criteria. Major criteria: findings. Migratory polyarthritis, large joints affected, improves while moving to another joint. Oh, my heart. Carditis, new murmur, mitral regurgitation. Nodules, subcutaneous nodules, painless, firm overextensor surfaces. Erythema marginatum, pink, wavy rash with central clearing. Item chorea, involuntary, jerky movements of face hands. Minor criteria: fever, elevated ESR CRP, prolonged PR interval on ECG. Why not the other options? A. Juvenile idiopathic arthritis? Incorrect. JIA presents with chronic arthritis lasting 6 weeks, but does not have carditis, erythema marginatum, or an association with prior strep infection. C. Scarlet fever? Incorrect. Strawberry tongue sandpaper rash in a child with recent strep infection, but no arthritis or carditis. D. Kawasaki disease? Incorrect. Presents with fever for core 5 days, conjunctivitis, strawberry tongue, hand-foot desquamation, and coronary artery aneurysms. No history of strep throat. Key features of rheumatic fever. Findings: cause, untreated gas, Streptococcus pyogenes, pharyngitis. Major symptoms: migratory polyarthritis, carditis, chorditis, erythema marginatum, subcutaneous nodules. Complication: chronic rheumatic heart disease. Diagnosis: Jones criteria plus ASO titers. Penicillin, NSAIDs, long-term prophylaxis. Would you